Great to meet you.
Hi.
Hi, Tina.
How's it going, Prashanthi?
Good, good. How are you?
I'm doing well, thank you. Given the circumstances, of course.
I know. It's one of those things that when, someone asks you, how are you doing today? And you say, great, you kind of feel bad. But,
Yeah,
we're saying, barring what's going on, try keeping a positive attitude, right?
absolutely, absolutely. Trying to do that, trying to keep as much awareness and education out there, for the immunocompromised. And I'm so, so glad that you asked me to be a part of this conversation today to help create that awareness.
No, absolutely. And, I think it's really important when I was thinking about the fact that everybody from all different walks of life, everyone's being affected by this, but in different ways.
Absolutely.
And
Absolutely.
when you're not in that person's shoes, you may not realize, okay, well, they are dealing with it in a different way. It could be a much more serious for them.
Sure.
And while if I get it, I could have a common cold. For someone else, it could be much more serious.
Absolutely. I know people range from having zero symptoms whatsoever to like losing taste and smell and then all the way to being vented. So I think there's such a wide.
Absolutely. So first of all, let's start off. Let's introduce you
Yes.
to who doesn't know Tina. She does a lot of amazing advocacy work.
Thank you.
And she's also someone who's a patient who's receiving medical care. And like you said, you're a professional patient. You've been dealing with this
Yes.
for a long time. Let's talk about your journey, your story.
Yes. So my name is Tina of ownyourcrohns.com. I do a lot of patient advocacy work, just as Prashanthi mentioned. Basically, I talk a lot about Crohn's disease, which is a form of inflammatory bowel disease. It's Crohn's and ulcerative colitis. And these are autoimmune conditions. And I have one of them, Crohn's disease, which I've had for the last 14 years. I've had just about 20 surgeries in a 7-year period dealing with Crohn's disease. I've also had something called fistulas, which are abnormal tracts that get created into different organs or onto the skin as a result of severe inflammation. So really, this is a condition that affects all of your body. It is definitely a bathroom illness as well, but there's many aspects to it that affect your skin, your eyes, your joints. It's really a whole body disease. And with regards to coronavirus, it becomes very, very important to take a lot of different precautions. And I think that's what we will be talking about today.
Yes. One of the first points I want to touch on is the fact that, if you see someone, for example, me, you and I are friends, and I see you
Yes.
and you look great, but
Yes.
you're dealing with a lot, and it's called an invisible illness, correct?
Yes. I think in a lot of ways, many illnesses are invisible. A lot of people look at me and they wonder why I don't work a full-time 9-to-5 job. It's just looks are very much deceiving with a lot of conditions, not just Crohn's or ulcerative colitis, but conditions like rheumatoid arthritis or lupus, even certain forms of cancer. You can't tell that people have these conditions. And it's not like we're wearing a bracelet or some kind of visual like representation saying, look, I'm chronically ill, I have disabilities, or I have these invisible illnesses, be careful. That's not available to us. With visible illnesses, with wheelchairs or mobility assistance, it's a little bit more heightened. People actually realize it. But with invisible illnesses, it's very, very difficult to sort of understand or delineate sort of those boundaries of, with social distancing, especially as we're seeing now, people don't know that I have this condition, so they'll walk really close to me, for instance.
And that's a good point that you're bringing up, because social distancing is so critical in
Absolutely.
the stop of the spread. And,
Yes.
while, again, like you look great, you look healthy, you're dealing with your own battle.
Yes.
And
Yes.
if we listen, if we follow the guidelines, then we're helping keep other people safe.
Yes, absolutely. And I think that's been the key point here for patients like myself who are immunocompromised. And I know we're going to get into this in a bit, but being socially distant from people is absolutely crucial. I live in New York City, And I know there's parts of New Jersey, there's parts of all over the country that can be very thickly populated. If I try to even go outside for like a simple walk, I'm trying to do it late at night, unfortunately, because I find myself serpentining around people because they don't know that I am chronically ill. But even still, it's very, very difficult for people to follow that social distancing, that 6 feet or more sort of distance from other people because of the density of the population of the areas we might be living in. But it's absolutely essential for patients like me because we can pick up infections more easily.
Let's talk about immunocompromised. And why don't you go through those immunosuppressed and immunocompromised?
Sure. So for a patient like myself who has Crohn's disease, I'm considered immunocompromised primarily because I'm on medication that's suppressing my immune system, but also I'm on medication that's modifying my immune system. So I'm on two different kinds of medications. One's suppressing, one is modifying. And because of that, I'm at greater risk for something like COVID-19. So there's this trending hashtag that you will see on Instagram or Facebook or other forms of social media called high risk COVID-19, hashtag high risk COVID-19. And that's because patients like myself, because of the medications that we're on, or because of our underlying condition, depending on the scenario, our immune systems might be compromised. As a result of that, we might need more hospital care, or we might need more urgent care in a scenario like this. And a lot of us have been asked to hunker down and really self-quarantine. So for me, even before this was announced a global pandemic, or even before this was announced a federal emergency earlier in March, I had already started hunkering down. My doctor was like, look, you're on these two different kinds of medication that, one, suppress your immune system, also modify your immune system. As a result of that, you should stay home, you should stay away, you should take extra precautions not to go to grocery stores. If you want to go for a walk here or there, please be very, very careful. He asked me to wear a mask. He asked me to wear gloves. He asked me to change right away when I came home. That type of thing. I've been also wiping down groceries that my partner brings home, which I think is also important with disinfectant wipes, of course, just to make sure that we're not spreading the infection to our countertops, or, touching our face and spreading it, via the mouth or the nose or eyes or however. So I think all these precautions are very, very important to take. But Prashanthi, just going back to what you were talking about earlier with regards to social distancing, because we're immunocompromised on so many levels and our immune systems might be suppressed, this makes social distancing extremely critical. Because if someone coughs and they're 2 feet away, let's just say, and that cough reaches us and we don't have a mask on, or even if we do and the particulates get through, or for some reason it gets on our hands or what have you, that can easily spread the infection.
Exactly. And I kind of want to go back into what you just said a moment ago about this is for you, but this is for everyone, the rules that you follow when you go out. And, now it is being urged that people wear a mask when they go to places like a grocery store or where there is any sort of somewhat of a crowd. But I agree with you in the sense that sanitize, wear your gloves, keep your distance. If you bring anything into the house, make sure you wipe down your surfaces. This is important for anyone immunocompromised, anyone across the board.
Absolutely.
It's really important. And something that I'm trying to, it's just hard because in general, as people, it's so many extra steps that I think that, sometimes you're like, oh, it doesn't really matter, but it actually does.
Absolutely. And I think you bring up a really important point. And one of the questions that I've gotten recently has been like, oh, so then why don't you just get off your medication for 2 or 3 months until this passes? And I don't think that's really an option either. These are life-saving medications for many of us. And I think patients like who have lupus and rheumatoid arthritis, they use hydroxychloroquine, which is being used in some of the hospitals to treat COVID-19. They use this medication on a daily basis. And I think this is really important for people to consider, is that these medications save our lives. And our doctors have advised us we need to stay well and healthy on our disease front, so that if we do catch COVID-19, we can fight it off a little bit better. And that's sort of the guidance that I've been receiving, the community's been receiving, and the guidance that I've been passing along to patients who reach out to me. So I think that's a really good point, Prashanthi. Thank you.
Yeah, of course. And Tina, what about some of the other things that people you know who may be in a similar situation, what are they telling you about their experience right now during the situation?
I think the experience right now has heightened anxiety, lots of fear, lots of just wondering what's going to happen. You know, this is a very tricky situation, because this is not just affecting the immunocompromised or the elderly. This is very much affecting everyone. And I'm glad you brought that up earlier, because we heard Governor Cuomo just say it the other day for New York State, and I believe this is the case in New Jersey as well, that, you know, a good chunk, at least in New York, it's over half, who are hospitalized are between the ages of 18 and 49. And I think this is a really important point to remember. This disease does not discriminate. And there's young, healthy 30-year-olds who are even being ventilated and even passing on. So I think it's extremely important that we all take the guidelines of social distancing, washing our hands, even wearing the masks, whatever guidance we're getting from the government and from our doctors is extremely important right now. Yeah.
Is there anything else that you think that people should know, especially in a time like this, that they may not, maybe when it comes to what you're dealing with, or just in general?
Yeah. So I think something that, you know, has been a struggle for me the last month or so is, you know, hearing about spring breakers. You know, I was diagnosed at their age with something like Crohn's disease, and it was really hard for me to hear that there were spring breakers partying in the midst of this, and really only wondering about themselves if they're going to get the disease. This is very much a social responsibility for us to follow. We can spread this pretty easily. We can have latent symptoms, which means we may be asymptomatic for quite a period of time, or just altogether, depending on our situations. Just know that we can be carriers, and in the patients that I've spoken to who have gotten COVID-19, there is a huge element of guilt, because they know they've passed this on to their moms or dads, or to friends, or because they've had parties. And I can't imagine living with that guilt. But on top of that, like, we have to consider that this is our social responsibility to make sure not only that we are safe, but that everyone stays safe in this process, because this is a virus that spreads like wildfire. And I think we have to keep that in mind at this time.
Absolutely. And, you know, it feels like forever right now. It's only been a few weeks.
Yes.
But the more we're socially responsible, the more we stay at home, the more we follow the guidelines, this will end quicker. If we,
right.
you know, if we decide that these rules don't apply to us and we're just going to live like normal before coronavirus, then it's just going to keep, it's going to keep happening. It's going to keep spreading, and we're not going to be able to control this.
I know, and I've heard like all sorts of situations of people asking others to go hiking or for a walk, but at at more of a social distance of like 6 feet. We have to understand that that's not okay, that that's not, you know, what the government's telling us to do and what doctors are telling us to do. We really have to abide by staying at home, only stepping out when we need to, or to go for walks. And this is not, you know, this is not a holiday. This is not, you know, time off for us to socialize at 6 feet apart either. And I think that's a really important point for us to also keep in mind. And something else I wanted to bring up, Prashanthi, before I forget is, you know, there is an aspect to this that I'm already used to as a patient, and that's being socially isolated. And I think there's a lot of members of the chronically ill community or of the disabled community who've been isolated as a result of their conditions in the past. So this is nothing new for us. And what I want to do is I want to encourage anybody with chronic illnesses to really help spread these messages. We know how to be isolated. We've done it well, and we can certainly share that wisdom with other people who might be other through this.
No, that's some great advice, and it's great perspective on, you know, what people have been dealing with before, you know, people with situations like yours. And the other thing I also just want to reiterate is staying positive. You know,
yes,
all of this can come across as staying at home and keeping your distance as negative, but we can still stay connected to the people that we love,
yeah,
and family. We can still, you know, think there is a light at the end of the tunnel.
Absolutely.
We'll get through this. You know, just focusing on what's good in this world, is focusing
Absolutely.
on what we have, having gratitude. And Tina, can I tell you, I'm sure that you've been hearing stories too. You know, for me as a reporter, I am constantly getting emails, or I'm doing stories about people who are reaching out. They're making masks for people,
yeah,
food donations, and seeing communities come together. It's just amazing. And that's what you can do. You can help people. You can focus on giving back.
absolutely. And I think that's a lot of what patient advocacy is, and that's a lot of what I've been trying to do, is make sure that people have the education and the knowledge that they need to take, their medications, but also to be well aware about what's going on with COVID-19, not overly so. I'm not saying, you know, be connected to the media or social media constantly. I think we have to take breaks. I think we have to take care of ourselves in the midst of this. But there are a number of things that we can do to stay grateful and to stay sort of in that moment and be mindful of what it is that we have at this time. Yes, this is a very, very difficult situation. This is a novel situation for many of us in our lifetimes, but we have the internet, we have TVs, we can connect with one another. And I think that's an important point to remember. We can play board games virtually. We can have dinners or happy hours virtually. We can celebrate, you know, Passover, Easter virtually. I mean, it's not ideal, but given the circumstances, at least we have these modes of communicating with one another and being with one another, even if we haven't seen one another in a while. And I think that's something that we have to be grateful for at this time.
Absolutely. One other point too, what you're saying, you know, about the virtual options, I think that's great. Also, you know, one thing is a phone call. It's so
Absolutely.
funny because I think that people forget that you can use the phone to actually make phone calls. And this is a time too where check on your elderly neighbors, you know, check on people that you know that are immunocompromised. Give them a call, reconnect.
Absolutely. And that's a really fantastic point. So in my building where I live, there's a number of us in here, and there's been notes posted in the elevator or outside the elevator shafts, basically saying, you know, if you're immunocompromised, if you're elderly, you need us to go get groceries or just need a hand, just let us know. That goes such a long way during this time, especially if some of us might be living alone or might be feeling sick. I think just reaching out, you know, I think there's been a lot of awareness around how this can affect the elderly, but I think we really have to keep in mind those people who are also immunocompromised, who might be young and otherwise look healthy, and really take care of them too. It's something that a lot of us struggle to even talk about and to raise awareness about. That's why I'm doing this, because I really want you all to understand how important it is for us to keep in mind the immunocompromised as well. And Prashanthi, I did also want to bring up, like, you know, I'm hoping that with the COVID-19 outbreak, that there's going to be more awareness and more advocacy for people who have chronic illnesses, and that we understand and sort of what's going on with patients like me as well, that we not assume that somebody is able-bodied, that we not assume that somebody is 100% healthy. And I hope that that kind of awareness comes out of COVID-19 as well.
Exactly. You know, if you do your duty, then you don't have to worry about giving, you know, spreading anything to anyone.
Exactly.
And if you don't, then there's always that risk. So why not
Absolutely.
just practice the social responsibility, following the rules, and then you don't have to worry, and you won't have that guilt afterwards of, you know, something that you obviously don't want to do.
Absolutely. 100% agree. Prashanthi, are there any questions that have come up that you want us to address?
So I've been looking, and it looks like everyone's just, you know, paying attention and taking in all our information. Please, you know, even after this Instagram Live is over, you can comment. We'll make sure that even if we don't have the answers, we'll find the person who has them, and we'll answer them. And Tina, is there anything you want to add before we sign off?
I think I just want to add, just always be mindful, always be open-minded in terms of who you're in contact with, who you're close to. I think one of the lessons coming out of this is just being more mindful of other people. And I think, you know, this is very much, as we brought up earlier, a social responsibility for us to take care of each other for the well-being of our public health care system and for ourselves. And I think that's something that we have to keep in mind during this time and going forward as we sort of make our way out of this pandemic. And I'm hopeful that we are going to do well, that we are going to get through this one way or another. Every day there's strides being made towards that. And I am very hopeful that there will be a medication or vaccine that'll be viable in the near term. If any of you have questions or need particular guidance or need me to connect you to anybody, feel free to reach out to either Prashanthi or to me. I'm available at Own Your Crohn's on Facebook, Instagram, and Twitter.
So I think we leave it there. And for anyone who's joining me that is not familiar, you can join me on Instagram. You can follow me. You can send me a message, Prashanthi BM. And, you know, we're here to help you. We're here to answer your questions, to, you know, make things transparent if they're ever confusing. So thank you, Tina, so much.
Thank you, Prashanthi, for helping me create this awareness and for thinking that this would be a viable sort of topic to discuss on Instagram Live. So I'm very excited to create that awareness. Thank you again.
No, absolutely. Thank you.
Take care.
You too.